Hello, my name is Dayan Siebra and welcome to another video. It was Lucien Maria on Instagram who asked me to talk about varicose veins and the latest methods for treating these conditions. You'd like to know about it too, so share this video immediately with all your WhatsApp groups, especially women's groups. Women, it's very difficult to find a woman who doesn't have varicose veins, isn't it? You who are watching me now probably have a varicose vein on your leg. Enjoy, subscribe to the channel, leave your like on this video, and don't forget to click on the little bell to receive notifications of new videos. And while I'm at it, go follow me on Instagram and see if the next video isn't a request from you, shall we? Starting the video, first of all, I want to tell you that I feel very comfortable making this video. Why? Because I'm a vascular surgeon. So I've worked with it for many years. And what else does a vascular surgeon do? Treat varicose veins. And varicose veins, the first thing, is a name given to those venous dilations in the legs anywhere in the body. In other words, the vein gets tired, loose, dilated, and doesn't work properly anymore. People call it Colombo nas pernas, Mondrongo, Biloto, I don't know what you call it. There's thick varicose veins, large caliber varicose veins, which are the big ones. There is medium caliber varicose veins, and there is thin varicose veins called telangiectasia. Telangiectasias are those very fine veins that most people have, right? Women call them the map of Brazil, or these spiders, these spider webs. Or people look and say, oh, I've got a purple spot. Actually, if you look closely, it's empty. And most of the time, people find out they have varicose veins in the following way. A woman comes up to another woman and says, hey woman, what's that on your legs? They're so purple. She says, I don't know, I think it's varicose veins. So sometimes the person doesn't even know what it is, and their friend finds out. A friend is an animal when it comes to finding defects. A friend notices that your nose is big. A friend notices that your ass is shriveled. Now, it's hard for a friend to tell. And usually the main cause of varicose veins is genetic. I particularly have varicose veins, and my grandmother left it to me. But varicose veins can also appear as a result of other things that get in the way, like obesity, working on your feet for a long time. Mine, for example, I have the genetic load to have varicose veins. But doing medical residency and spending hours and hours on my feet, operating or assisting in surgery, I spent 10 hours on my feet. And that was a determining factor in my varicose veins appearing, as well as a sedentary lifestyle. If you don't exercise, you don't strengthen your calf muscles, the calf muscles. And it's this muscle that makes the blood go up from the legs to the heart. Because to go down, every saint helps, but to go up, you need a strong calf. When you don't exercise, your calf becomes weak. And the calf is known in medical circles as the peripheral heart. It's what pumps the blood upwards when you exercise, so if you don't exercise, the calf becomes flabby. More blood accumulates in the leg, it dilates in the veins and causes varicose veins. But there are also hormonal changes pregnancy. Most women who become pregnant get varicose veins during pregnancy. It's true that they disappear afterwards, but many do. There are other reasons too. People who work sitting down for a long time, like bus drivers, like people who study all day, or people who spend a lot of time standing. As a nurse, a clerk, a sales assistant, a surgeon, a teacher. So a lot of people have this profile of spending a lot of time standing or sitting for a long time. And when these veins can't bring the blood back from the legs, then you start to get symptoms. Dayan, what are the symptoms of varicose veins? Heaviness in the leg, tiredness, impatience, especially at the end of the day. It only gets better when you put your legs up or have a massage, and then it can also appear swelling, itching, fumigations in the legs, cramps. These symptoms even worsen when you're close to menstruating. Hyperpigmentation of the skin can occur. In other words, your skin gets darker, something called dermatitis ochre. And then if you don't treat it, eczema can appear, and then an ulcer. Eczema is a little lesion. It's like a little flower coming out of the skin, and then it hurts. It becomes a wound. You've probably seen a few people in your town, or at the traffic lights begging for money with a thick leg and a bandage around their ankle from a wound full of varicose veins. That's the image that comes to mind. Pay attention from now on. Someone at a traffic light begging for money, with a swollen leg, black with a wound. People with varicose veins are very common there. Now, Dayan, okay, I get it, fine. to treat and improve the condition of the person, the patient, before moving on to surgery or laser applications or injections. So remember that for varicose veins there is clinical treatment, which is to improve the pain. This doesn't make varicose veins disappear. Don't believe in medicines that make varicose veins disappear. As they say on the internet, don't believe the cream that makes varicose veins disappear. It's all lies. It doesn't disappear. For varicose veins to disappear, it's either surgery or an application. Period. Now, symptoms improve with clinical treatment, with cream, with pills, with exercise, but the main thing is elastic stockings like this one. You can see that this is my sock on the outside, and this is the very stocking. Why do I wear them? Because I'm going travel. I wear them because I'm going on a trip. I'm going to sit in a car for 3 hours. So that's why I wear it. So if you have varicose veins, the first thing you have to do, go to a vascular surgeon so he can see if it's possible for you to wear stockings. Don't buy stockings without seeing a doctor. These stockings could squeeze your leg. And you could also have a problem with lack of blood, which is another problem, right? So you need to see a vascular surgeon so that he can fit you with the right sock in case you need one. In addition to stockings, there are oral medications which improve the functioning of the veins, and creams too. There's physiotherapy, manual lymphatic drainage. And if you have thick varicose veins or medium caliber, an excellent option. Even today, it's surgery. Me particularly, I think varicose vein surgery is wonderful, especially by Brazilians. The Brazilian vascular surgeon. Who is the best varicose vein surgeon in the world? Why Dayan? Because Brazilian women are very beautiful, and they use their legs a lot. They have beautiful legs, unlike American women, which are the cambito. So Brazilian women have nice legs, and she wants to show it off on the beaches. So the Brazilian surgeon has perfected himself in performing varicose vein surgery with a minimum of aesthetic complications. In other words, there's little scarring, few blemishes, so surgery is a great option. For those with thick varicose veins, in traditional surgery, you make small cuts along the varicose vein and you pull it out with a crochet needle. Exactly that crochet needle, the one you know from crocheting, you pull and squeeze the area so that it doesn't bleed. It's common for this surgery. There are some bruises, and it takes about a week. To return to normal activities, the post-operative period is relatively simple. You stay at home, no work for a week, with your leg up, and then you return to normal activities except for physical activity, because then it takes a little longer. And apart from surgery and clinical treatment, we have laser treatments and the needle applications. Laser treatment, it can be done on thick varicose veins, but it's inside the varicose vein, like a catheterization. And it can also be done through the skin, with rays. So usually a fiber optic, it goes into the thickest vessels. It's a fiber the size of a hair, the thickness of a hair, and the procedure is accompanied by an ultrasound. The doctor monitors it. He usually punctures the vein. He makes a puncture and he inserts it there. And during this procedure, yes, there may be some bruising, but there's usually less bruising than in conventional surgery. Recovery is quicker. Now I still prefer conventional surgery. Ah, but you're too old. No, I've seen many cases, I've done many cases of traditional surgery, and I've seen many cases of laser inside the vessel. I've seen some cases they had to do it again because part of the vein hadn't disappeared. They needed to inject foam, which is another type of treatment, in the places that hadn't disappeared. Anyway, surgery was a more practical and quicker solution, and today it's one of the applications that has produced the most results in Brazil and around the world. And I can say that in my region in the Northeast, I was one of the pioneers to bring it here. It's the application with polydocanol foam. You take a little cream, a little liquid, a little detergent liquid. It turns into a foam. You shake it between two syringes. It turns into a kind of foamy detergent cream, and you inject it into the veins. This foam will stick to the vein wall. It will inflame, and a clot will form there. It will block the vein, and that vein will be absorbed by the body. These applications with foam or laser, usually the patient goes home after the procedure. They don't stay in hospital. And you can also treat large varicose veins with foam. Although I don't like this idea very much, I'm afraid of putting this foam into a large vein. It'll get full of clots in there, and these little clots get into the lungs, causing a problem called pulmonary embolism. I didn't have the courage to do this at the time I was working. I preferred to do the foam in a medium vein and small veins, and I particularly liked it at the time. I didn't really like the results of the laser. I know that lasers have come a long way since I was in practice, But at the time I didn't like the results of the laser. The laser wasn't as effective as a conventional application. But today, as I'm telling you, lasers have probably come a long way, so things should be much better. Now for those of you who can't undergo surgery, who has a heart problem, with uncontrolled blood pressure, or diabetes, foam can be a great option as a laser too. Just like the laser, foam is very quick to recover from. With the foam, the patient needs to wear an elastic stocking for the first few days. This stocking not only reduces pain, reduces bruising, the hardening of the vein. It will help you recover more quickly, but you always have to be careful with the application of foam, especially with regard to allergies. It's a product that you're injecting into the vein. And also in relation to thrombosis, there may also be stains where it was applied. And hardening, the vein will become thrombosed, so it's common to have a foam application and feel a hard lump along the entire vein, and in the same way as the laser. Inside the vessel, the foam also needs an ultrasound to monitor its injection. If the vein is not completely destroyed, obliterated, clogged with the foam, then you need another injection. To finish the application, there are very frequent doubts among people who have varicose veins. The first is, do heels cause varicose veins? Yes. What type of heel? Or very high, or flats? So the ideal heel is the one with 3 toes, 3 little toes. It's the Annabelle. It's that heel that constricts the calf, but it's not too high and not too low. The second question is, small vessels, when left untreated, can they become larger veins? No. Small veins can increase in quantity, but it doesn't increase in caliber. Now the vein. When it's already thick, it can get thicker, but when it's thin, it doesn't become a thick vein. Third question, varicose vein surgery. Can it prevent new varicose veins from appearing in the future? Remember, varicose vein surgery. It will remove the ones that are there. Whether other varicose veins will appear there, nobody knows, okay? But a well-done surgery, well done. Correcting the stitches that are insufficient. Sometimes you have a problem with the saphenous vein. When you correct it, you reduce in a really substantial way the amount of varicose veins that would appear in that leg. So if you've had a well-done operation, it's unlikely that you'll need to have another one of the same size. You may need a supplement in the future, something smaller. Yes, you might. Another question. Are there so-called internal varicose veins? Yes, there are. Internal varicose veins are as follows. They're those veins that you can't see, but they're there on the inside. Deep varicose veins, insufficient veins, inside the muscles. There are also internal varicose veins elsewhere in the body, in the stomach, in the esophagus. There are also pelvic varicose veins. In other words, inside the uterus. The ovary, which causes pelvic pain, we could even make a video about this. We could even make a video about pelvic varicose veins if you like. Another question is, can varicose veins cause complications? Yes, they can. Vein thrombosis, swelling in the legs, pulmonary embolism, because thrombosis is a clot. Sometimes it can get into the lungs. It can happen. Rupture. The vein can bleed, and you go to the emergency room with that little thing. Pissing blood. That's right. It looks like blood, and where it sticks it can turn into an ulcer, which is a wound. That takes a while to heal. Eczema, as I've already told you, dermatitis ochrea, which is that dark spot, because if the blood stays in the leg for a long time, the blood has iron in it, then there will be pigmentation of the skin around the varicose vein through the iron. And then there's otic dermatitis. It can be itchy in this area of otic dermatitis, and you end up hurting it, and it becomes an ulcer. Everyone who has varicose veins has a greater chance of getting a leg injury. Phlebitis can happen. These are inflammations of the veins in the legs. It's a hard inflammation. In other words, it's a thrombosis of a more superficial vein. That's why it's very important. See a vascular surgeon if you have veins in your legs. And you know something about varicose veins too. Watch this video and don't share it before you leave. Leave a like and live healthy. Live with passion, with God in your heart. Bye guys.